panel here, and for whatever period, we have it listed for an hour and a half, but it doesn't have to go an hour and a half, just so you're aware of that. We have three people who are very involved in this unexpected ending of life type of issues. First is our own Dr. Gregory Warth, who is an internist. Internal medicine, he is part of Virginia Beach Premier Medical, which is a concierge medical practice out by Virginia Beach General Hospital. He's been a member here for many years. What is it? Did you come right away to Ascension?
Since 1980, I think.
1980, okay. He and his wife, Diane, we're so happy that he agreed to be part of this. And concierge, you heard about concierge? I wanted to tell you quickly what it is. It's the way it was meant to be practiced. That's what medical practice is for concierge doctors. So if you ever want to talk to him a little bit about that and find out exactly what he does, I'm sure he'd be happy to tell you. Greg was born in Canton, Ohio, got his medical degree at the Ohio State University College of Medicine in Columbus, and he is board certified since 1976 when he moved to Virginia Beach. Peers have recognized Greg as a top internist in Hampton Roads, and he's a fellow of the American College of Physicians, which is dedicated to continuing education in medical practice, among other things. You may not know this about Greg, and this is not as important as his medical practice, but he is a model railroader, and he is very, very dedicated to that hobby. Anyway, thank you, Greg, for being part of our program tonight.
Thank you, John.
Jody Minnich is a nurse. She's a registered nurse. We've imported her from Star of the Sea for tonight. We appreciate her coming. Jody and I have known each other for a number of years working at Centera Home Care, and she comes from the great state of Pennsylvania, grew up around Pittsburgh area, was a hospital corpsman. She and I actually spent time at the Navy Hospital in Philadelphia in the early 70s, but we didn't know each other. So as a result, I only found that out after we started talking once about our backgrounds. She's got a Bachelor of Science, she's got a Bachelor of Arts in Hospital Administration. She has 15 years experience working in the hospice industry as a nurse, currently working home care with Centera. And she told me she assesses people in the home and is able to recommend palliative and/or hospice care. And I think that's part of what we're all talking about tonight. What do we do with hospice? What do we do with palliative care? She has the distinction of living with two fine young boxers. One is named Floyd and one is named Olive, and they are the cutest dogs that once you get to know them, they will love you to death. So anyway, thank you, Jody, for being part of this program tonight. And our own Deacon Gary, Deacon Gary Harmeyer, with his wife Karen, they joined Ascension in 2000. He was ordained a deacon in 2003. After a 3-year hiatus to assist with the transition of pastors at St. Nicholas, which was in 2010, where he served as their pastoral assistant, he was reassigned right here to Church of the Ascension in 2013. Gary, as you may know, Gary is a registered nurse, as is his wife Karen, and he rose to the rank of captain in the Navy, so I have to salute him every time I go by because I was only a commander. Anyway, his main ministry is with the sick and the homebound. If there's anybody who has experienced being put on the homebound list, Gary is the primary person that comes to visit. In addition to his diaconate assignment at Ascension here, he serves as the senior pastoral associate for the ecumenical community of the Church of the Holy Apostles over on the New Haven Parkway. Tonight, He's joined by our parish secretary, Joanne Webb. Where's Joanne? There she is. Thank you, Joanne. And Joanne, being part of the staff of the parish, is going to talk specifically about our columbarium that we have out here. So, without any further ado, I'm going to ask Dr. Warth to come up and just talk about some of the medical decisions that he has to deal with patients, with individuals, and how all that kind of plays into to how we approach our end of life and moving on to the next venue. Dr. Warth?
Okay. Thank you, John. You want to have them do questions at the end, or can they ask anytime? So you can ask questions at any time. If you have a concern or something I say that you have a question about, don't hesitate to let me know. I guess the first thing that we need to talk about is that how do we make the diagnosis? You know, when somebody comes in with something wrong with them, they know there's something wrong, and they come in and they tell you what's wrong, and they're usually a little frightened right away because they have a suspicion that it might be this or that. They hope you don't say the word cancer, and I don't usually or right away, but so anyway, they usually have something wrong, and we do a workup, and then we find something. Now, it's not always cancer, too. A lot of people think end-of-life issues. We talk about just cancer patients, but no, it could be heart failure, it could be dementia, it could be other things. There are a lot of end-of-life diagnoses, but let's just assume that it's cancer just for the purpose of talking about it. So anyway, we do the workup, and then the x-ray comes back, and it says, there's a little nodule there in the chest, and we have to tell people, well, you've got something going on there that we've got to check it out. And they usually say, well, what do you think it is? And is it this or that? And sometimes they'll say, do you think it might be cancer? And I'll say, well, we just don't know yet. It could be, but we have to check it out. So we go on with the workup, and we usually have to get a biopsy. And once the biopsy comes back and it shows cancer, then at that time, we can say, yes, you do have cancer. And of course, this immediately changes their entire life when you tell them that. They don't remember a thing about the rest of the conversation that you have with them that day. So you have to have them come back and talk to them some more. So already, the patient is suffering right off the bat, and they're afraid, and they don't know what's going to happen. Elizabeth Kubler-Ross, she had those 5 stages of grief, and we all have read about those. We know what they are: the denial, anger, bargaining, depression, and acceptance. But I would like to add to that the fear or the fright that people have, because that's present throughout this whole process. And so I think that really ought to be a 6th thing that's part of that process. And everybody's afraid of the unknown. Nobody knows what's going to happen to them. They need to know. They need to get some communication about what's going to happen. How's this going to go? And so you tell them, and you try to be as honest as you can. Sometimes the families will say, well, don't tell him, it'll hurt him, it'll make him feel bad. That's not the right thing to do. You really need to tell them. They're going to know anyway. They know there's something wrong with them. If you just try to hide it from them, that just never works. And then they end up not trusting you or anybody that lies to them. So you just can't do that. So they really, so you tell them, where do I go from here? And so we say, well, we're going to have you see a cancer specialist, and then he's going to go over things and review the biopsy and try to decide, what the best course of action is. So they say, okay, and we try to make that happen as soon as possible. And then we get the report back from him, and usually the oncologist will help us decide which way to go. I trust in the ones we have around here. They're usually quite good at what they do. So, usually there's either some radiation or chemotherapy, and so we discuss all of that with the patient. We let them know what the side effects are going to be. If they get radiation to the chest here, they may have esophagitis afterwards. They may get a burning sensation in here. They may have trouble swallowing. A lot of things can happen with that. With chemotherapy, they might get nauseated. They might throw up. Sometimes you get really tired and fatigued with that. The way they do chemotherapy these days is much better and a little easier than what it used to be, but it's still not a piece of cake. Anyway, they may go through several of those treatments, and then finally they, not always, sometimes they can really get a good remission, but sometimes they come to the point where, they've had all the chemotherapy and all the radiation they can have, and so now they got to face the fact there's nothing else to do. And so what you don't want to do as a doc is say, well, there's nothing else to do. You don't ever do that. So you say, well, they say, well, what do we do now? And, how am I going to get through this? And what's going to happen to me? And so you say, well, we're going to try to help you as much as we possibly can in every way we can. We'll try to take care of your pain. If you get short of breath, we'll take care of that. Put you on oxygen. We may get palliative care involved. These are specialists that know how to deal with making people comfortable. If there's no other specific treatment or cure for the illness, then that's the direction we go. And we really try to reassure people that we will not let them die suffering, because that's the thing that they mostly worry about. And the families, of course, worry about all of that too. And by the way, while you're talking to the patient all this time, you're talking to the families too, because they're suffering also. They're going through the same grief reaction and fear that the patient is. Sometimes it's even worse for the family. So anyway, and you want to keep those channels of communication open all the time. I mean, when the family calls, you want to talk to them. They've got concerns. You want to be able to answer their questions. You want to answer the patient's questions. If they know that they have a good line of communication with their doctor, that gives them a lot of reassurance and helps them feel better about things. And then, then at the point where we say, well, we're going to do all of this to make sure you're comfortable. However, there are people who, besides palliative care, who specialize in helping you with this process. And then we start talking about hospice. And there are certain rules and regulations to get into hospice. The most important of which is that the doctor has to sort of verify that they have about 6 months left to live or less. Well, I kind of cheat on that a little bit, and I don't know, because we don't know sometimes. And so, if they're at the end of the line and we've done all that we can do to cure their tumor, then, sometimes we'll say 6 months. But, they don't, fortunately, the hospice people don't hold you to that 6 months, and so if it goes a little bit over that, that's okay. I did have one person I thought was going to die of COPD, and I said, well, she has 6 months left to live, because I thought that was the case. She really looked bad. She went on 2 years, and then, then hospice gave up on her, and they said, well, we're not going to cover her anymore. But anyway, I mean, seriously, it's when they get to that point, usually their days are numbered. And so we need people like palliative care. We need hospice, and I know Jody's going to talk more about that. Sometimes when they're in the hospital, they've had an acute event or whatever, and we have them in the hospital. I try to get a chaplain involved, or a priest, or try to get somebody to see them along that line. If they're not Catholic, then we get a chaplain. They're available. If they're Catholic, then we try to get a priest to come and see them. So, I mean, I think that's important. And another question or another thing that people ask is, do I pray with people? I pray for them all the time. I'm not real comfortable praying with them or with their families, although I've done that, but I leave that more for people like Deacon Gary and for the priests. But what I do is I do exhibit evidence of my religious background, and frequently, people will ask me, what's going to happen, and I said, you're going to be okay. I think this is just a transition from one place to another. You're going to be, it'll just be like traveling and going to a new place. And you'll maybe miss your family and they'll miss you, but it's a new place. It's just a different place. And one lady said, well, how do you know that? I mean, how do you know? I said, I just know. I just know. So anyway, that's sort of what I do and how I go through the process with patients who have an end-of-life illness, and then I rely heavily on my palliative care team and the religious team and hospice. So.
Okay, you hold on. We'll take questions. At this point, Diane's got a microphone that we'll use. I'm going to ask Dr. Warth one quick question. So you have worked very closely with clients in your current arrangement with practice, but I'm guessing you've also seen people who've come in to see you who might be fairly new. So my question is, how critical is it for that patient, that individual, to have a really closer relationship with a physician?
Oh, I think it's, thank you. That's a good question. I think it's critical. I think that is, you need. Oh, I'm sorry. Yeah, so you really need that relationship. I think that can help so much. And I do try to establish a good relationship with people. I mean, sometimes they don't have that much wrong with them, but I still see them at least every 6 months. And, some people I see a lot more than that. But if they start getting ill, of course, I'm seeing them much more frequently. And I'm trying to provide support for them and help for them all the way along, being truthful all the way, never tell them something, with rose-colored glasses. But anyway, it's critical. And then when they do get to the point where, there's something really wrong, they really appreciate having somebody they can call and somebody they can trust in. And a lot of people, when they have to sign the form for the hospice people, at the bottom of the form, there's usually a place where, you can either accept the hospice doctor and have them take care of you from now on, or whether you want your own doctor. And all of them write my name in there. So, I think it's critical. I think it helps tremendously.
Other questions? Okay, there may be more that come up. Thank you very much.
Mm-hmm.
Now, Jody and I know each other for quite a while now, and she is going to kill me because she said she didn't know I was going to have such an audience, and that she thought it was going to be a little round table discussion. So be nice to her, okay?
Hi, I'm Jody, but John, I'm going to kill you because Floyd's already in heaven. My new boy's name is Vinny.
Vinny?
Yes, but they're boxers. They're 100-pound lap dogs. And John's not fond of them. But anyways, I'll tell you a little bit about my experience with hospice. It was about 35 years ago. when my mother came home with hospice because there was nothing else they could do for her. And it was, you're just going to die at home. And it was not, do you have family members to take care of you? Is there anything in place? That's how it was for my experience 35 years ago. So I was in Hawaii and I came back to Freeport, Pennsylvania to take care of my mother, humanitarian. So that was my first experience. And even though they said, this is the end and the end is coming, we had 10 good months. So even though they said things like, you can't go out of the house, I put the oxygen on her, I rode her up and down the freeway, we went out to lunch. It might have taken a lot longer, but she had a good 10 months, and she was able to die in her home, in my arms, and I was able to tell her she had 3 girls, that we would be okay. And that seemed to, reassure her. So that was my first experience. And then I came here to live. The military sent me here, and I was a member of this parish for almost 15 years with a food pantry and cooking down at JCOC. I didn't have a lot of experience in the medical field at that time, but I was a volunteer with Hospice of America. And it was off Wichita Road, and this gentleman by the name of Gene did it, realizing that hospice didn't have a lot of resources. So I did that, and they would give me the patients that, if they had heart disease and their families wouldn't let them eat chips, I'd give them chips because their family would entrust them to me for hours. Or, whatever it was, I was always there for the patient, and that is true for me today. As the doctor said, it's always best to be honest. That would never be that's not my phone. That's probably God saying, turn that off. Just kidding. Anyways, I think it's the most important thing is to be honest to the patient, because I always say a doctor diagnoses you, but, God fixes you when he's ready, which means takes you home. And I am comfortable praying with the patient, with the family, or offering them to contact whoever they would feel more comfortable with, because it's no longer with HIPAA. A priest just can't go to the hospital and say, which one of my parishioners are in here? That's how it used to be, but that's not how it is. So when I have patients in the home, I work for Centera Home Healthcare, and it's truly an aged population. I still have young people that have diseases that aren't going to be with us for a long time, but typically it's your Medicare patients, your older patients. And so when I talk to them about a disease process, not the first visit or the second visit, but when I realize there's comfortability and they have welcomed us in their home and they allow us in their home, then I talk to them about, well, did you ever think, this is maybe where you want to spend your days, or do you need family members to be here with you? I try to get around it a little bit and then continue to say, as we're moving forward with your disease. And then sometimes I just say, when the end comes, do you want to be here, or should we prepare for the hospice house? There's a wonderful hospice house here, and insurance does pay for it, or do we need to get family members? What do we need to do so that you have the best experience possible? And then I'll tell you a little bit about the palliative in the hospice, but if they ask me what it's going to be like, of course I always, just as the doctor says, I don't know, but I can tell them that it has never been an uncomfortable experience for anybody I've been with, and I've been with a lot, and that is because of the medication that we are allowed to bring into the home, help with anxiety if you can't get your breath in, help with pain if you're having, like, say, bone cancer. Whatever it is, I'm telling you, we can have a pill or something, not a pill, something under your tongue or to fix it. So I do give them that reassurance. And what I also tell them is I will make sure that you don't die alone, you know, if you happen to live by yourself. You can't go home with hospice if you live alone, but you can have palliative care if you live alone. So I do make sure that people know that we are able to put things in place to help you. So palliative care is comfort care. It is taking care of what ails you. If it's pain, if it's breathing, whatever it is, it does not mean hospice. It does not mean the end of life. 35 years ago, it used to be so-and-so had cancer, they went into hospice, and they were gone in 2 days. That's why nobody ever wanted hospice, because it'd be like, I'm going to go in 2 days. But I can tell you that the 6-month rule is very, very flexible. We have had patients on hospice for a year and a half. Once you go from palliative to hospice, what that means for us from the insurance standpoint is that there is not a solution to fix your problem. So if you have COPD, we can't make that better. If you have metastasized cancer, we can't fix that. It means that you are not going to get better. So that could be a year, year and a half. There is a company in the area, and I don't know if it's okay to say that we don't promote this, I promote it personally. It's Frida Gordon, and they will bring palliative care into your home, paid for by insurance, while you have regular nursing. You do not have to go to hospice to receive care from this one particular organization. I think it was formed by the Sandlers here, so everybody can keep that in mind. And then they also have a little caring and guiding adults of all ages about your health care, some questions to ask. You know, might you be ready? Do you know a friend that's ready? And I think it is very hard for people to discuss. Are you ready, or have you thought about it? I think it's been, in my experience, harder for the family members than it is for me. And I am always the one to say, is there anything else you need to do? Is there anybody you want to call, any family members? Is there any kind of like wrongs you need to make right? Is there anything I can do for you? Because the family has a difficult time with that, particularly if there's not really good cohesiveness. And then I tell them about the medication. I tell them what it does for them. I tell them about their respirations will get a little lower with morphine as they're a little bit more comfortable. I tell the family, you know, what the medications, how they affect them, what they can expect, what they can look for. I do as much as I can for the patient and the family. Whatever they ask me, I will try to get the answer for it, and if I don't know it, I'll come back with it. So I hope I will. So that's just been my experience with hospice and palliative care, that there is a misunderstanding that hospice means you're going to die soon, or palliative care means, can I still take care of other issues? If you're having palliative care, you can take care of everything. You can go to the doctor, you can go to the hospital for dialysis, you can do anything you need to do to take care of yourself. If you have hospice, if you have been received into hospice care, this is an example, and it's kidney failure. You have agreed not to seek treatment for the kidney failure, but if there's something else that you need to go see a doctor for, a cold, pneumonia, your diabetes, whatever it is, you're absolutely free to go for that. It's whatever you're in hospice for, you're not going to seek treatment. I don't know if that Did you get that? Okay. You got it? All right. I hope I didn't confuse anybody, so if anybody has any questions, I could certainly clarify it, but yes, John,
Questions,
I
please.
knew he was going to do this.
Questions? Everybody knows all the answers, right?
Yes,
here's a
ma'am.
question. Yes. Wait, hold on here a second. Here's a microphone for you.
I'm scampering.
I thought palliative care was not covered by insurance.
Palliative care is not covered by insurance. That's what she said.
Did you say is not? It says in their brochure from Freedom that some is. So, and palliative care, certainly, it's Centera is, so, oh. See, I'm still taking orders. And palliative care in the hospital is certainly covered by your insurance, and there's palliative care doctors and NPs. There's a whole department in the hospital that is palliative care and comfort, say for rheumatoid arthritis. Bone cancer is extremely painful. So there's different diagnoses that the palliative care team is going to address and send you home with that medication, and insurance does cover the medication. Do they cover the visits in the hospital? Yes, that's what I do, yeah. I don't want to give anybody wrong information, but they certainly do.
Susan is going to get the microphone.
You mentioned a hospice house. Can
Yes.
you tell us where that is and what hospice facilities there are? I know you said you're home health or home hospice, but outline for us, if you know, in our area what there is.
There
please.
is a hospice home off of Healthy Way, and it is run by Centera, and that is, if you get off the freeway on Rosemont, and you go left, is that north or south?
Come south.
I don't know.
Come south.
From here?
Come south from
Okay.
the expressway.
And then turn on Healthy Way, and they are single, and your insurance pays for that. And I have had patients that are homeless that I have gotten in there. Of course, there's no insurance, but there's always grants, and there's always ways to help. And they're single rooms, and they have a couch that pulls out. It's a bed. They have flowers in there. They have like classical music. They have whatever you want. And they also have a protocol of medications to give with symptoms. So if the respirations are getting difficult or the breathing, then they can give this. So that's one of the ones. And they also have hospice in the hospital. If you needed to stay there, if you didn't have anybody to be with you at home and you were terminal, not long-term, they would send you to a nursing home. But if it were a few days, they will keep you in the hospital on hospice care. Yes, ma'am. Oh, sir. The masks.
Yes, thank you. One, how many rooms do they have at the Centera facility? And two, how do you qualify for palliative care, and is that indefinite? Because I know hospice, you said there's, quote, approximate 6-month life expectancy.
My experience with palliative care, and the doctor can correct me if I'm wrong, is there's no limit. There's no limit because if you're being treated for pain, pain doesn't stop. And then you would come out and go to like maybe pain management. Maybe that's how it is. At the hospice house, I think there's 12 rooms. And anybody's free to go over there and visit. I think it's very nice. I've had a few patients there, and yes, I do take my dogs to visit people because they just love that comfort. They just love that unconditional smooch.
Question over here?
Yes, sir.
The
This
name
is-
of the company on the brochure.
This is Frida H. Gordon Palliative Care, and their number is locally 321-2242. And I say that because this is being videotaped here today to be available later, so people who want to look into that, that's available. Let me, okay.
And this is the Jewish Family Service Center.
Okay.
That's what this is.
Well, we like Jewish people. We used to have them here for 10 years.
I remember that.
I just want to add, as far as this hospice, because I'm an occupational therapist by 40 years of experience, and families are the ones who gain just as much from hospice care. Because families, as Dr. Warth mentioned, a lot of times they're the problem. They need to have the information, the calming, and all the services that are available from that type of approach. And it irks me because I'll hear, oh yes, they died and they were just put in hospice 2 days ago. That is not what hospice is supposed to be for. So I want you to be aware of that in case you ever have the opportunity to be involved with somebody who's on those doorsteps. Get hospice in there.
Right.
Okay. Any other questions? Yes.
Yes.
Ernie. There's your microphone.
Hey, thank you. Appreciate all this. Are there any agencies that provide advocacy for people that are really bad off and going through either nursing homes or something like that? We had experienced a couple. They were part of the parish here, but it seemed like there was no one advocating for them. Is there organizations that provide advocacy? Like, for example, if someone is older and they go into a hospital bed and they're there for 3 weeks, they may not be able to walk again. Who is there to help them? Is there someone there to help them? As an advocate, patient advocate?
In home health, that would be the nurse. I would call the doctor and say, I need a bed tomorrow for comfort. And it comes.
There are patient advocates in the hospital. You can, yeah, a home health nurse is frequently the advocate. Family members sometimes step up and they're advocates. Sometimes the doctor is the advocate. You know, if you call me up
Catholic
and say,
Charities.
if you say,
I was just going to suggest Catholic Charities already has a guardianship program, and they can be assigned a guardian then to follow them. Yes.
And they help with the paperwork, the will, and different things for patients that don't necessarily have the finances, but need that in place.
Any other questions? Okay.
Thank you.
How about for thank you, Jody.
Oh.
Very good. Has anybody thought of a question you'd like to ask Dr. Warth before we go on with Gary's presentation? Any questions?
I just want to reiterate something John said, and that is, don't call hospice at the last minute, because it just doesn't work well that way. I mean, a lot of people do. And, you know, somebody's been sick with end-stage disease for 6 months or longer, and I frequently ask, well, do you want to call hospice? And they, no, we're not ready for that yet. And actually, you know, the sooner you call them, the better. The family will benefit, the patient will. And there was one study in the New England Journal a few years ago that showed that people that entered hospice early actually lived longer. So, just
Excellent point. And that's why I'm glad you folks are here today, because, again, I think an awful lot of people just don't understand how it works. And now you're going to be in a better position going forward for yourself, for family, for friends. Okay, Deacon Gary, you're going to be up here at the podium, I assume?
A couple things before I start on things that happen after you die. In 2008, one of our parishioners here, because I was ministering to the sick, said, would you mind going over to this nursing home to visit my mom? She's on hospice. And so I went over and I started seeing her on a regular basis and everything for about 2 years before I left Ascension to go over to St. Nicholas. And I was at St. Nicholas for 3 years, and when I came back, she was still in that same nursing home. Now, she came on and off of hospice during that time, but she only died last year. So, as doctors mentioned, this is an art part, not necessarily a science part, although science comes in as well. And I would be remiss without mentioning something about the sacrament of the sick, anointing of the sick. As all of you of a certain age, you remember it used to be called extreme unction, and you got it right before you died. They had little sets that had a crucifix that you took out, and you put the crucifix so it would stand up, and there was 2 candles in there, and some holy water and everything else. Well, over time, then that has kind of changed in the sense that it's anointing of the sick. It's expected to give strength, spiritual strength, certainly, but sometimes it also gives physical strength to the people who are undergoing this issue, this illness and everything else. And so the best time to be anointed is when you can actually be aware of the fact that the priest is there and that the priest is anointing you. If the person is comatose, certainly as long as they're still alive, they can receive the sacrament, but they aren't getting anything from it, from a physical standpoint, certainly from a spiritual standpoint. And certainly the family as well will get something from it. But the best time for anointing of the sick is while the patient can still understand what's going on. And also, only priests can do anointing of the sick. And the reason for that is because it's an opportunity for the person to go through reconciliation. And of course, that's one of the things that a deacon is not able to do. And so that's the reason why, if you call me up and you say, Gary, can you anoint somebody? And I'll just tell you, no, I can try and get in touch with Father and everything else. But I can't anoint people because of the opportunity for reconciliation. So moving on to my particular topic, it seems like death is a pretty common thing. If anybody saw The Last Catholic Virginian, then one of the lead-off articles for the question and answer thing is Funeral Mass Commends Deceased to God's Mercy. And the question that comes up is, may a Mass of Christian burial be celebrated for a baptized person who has been for many years away from the church? And the priest's answer is yes, they can. If you have been a Catholic and if you're a lapsed Catholic but you want a Catholic funeral, then a priest can certainly celebrate that funeral for you. It's the same thing that in the past when I was growing up, pre-Vatican II, if somebody had committed suicide, if somebody was a murderer or something else, then the priest could say that they were not going to be celebrating that particular funeral mass because of whatever it is that the person did. Fortunately, what has now come around is you don't know where that person was at that end of life. I mean, it's like Jesus being up on the cross where he had the 2 thieves on both sides, and one was repentant and the other one wasn't. And so the repentant one, Jesus says, well, he will be in the kingdom with him that particular day. And so we don't know what the mental state is of that particular person. And so, it's open for a funeral mass. Okay, with that said, I'm going to go through different options because a lot of people only see, if a Catholic dies, then you've got to have a funeral mass, and that's the only thing, or the only way. Or perhaps some people are lapsed Catholic, and our family members are not Catholic, and so they would feel uncomfortable if they have Eucharist added. Well, there are options that are out there, and so those are some of the things that I want to cover with you this evening. So there's a vigil for the deceased, and what that means is that, if the person is at a funeral home, and if you are going to have some type of service there, there are prayers that the priest, the deacon, can come and say at that particular service, and I'll get into that in just a minute. Then there's a funeral mass, which we're all familiar with, but there's also a funeral liturgy outside of Mass, and that's what I was just mentioning. You know, if, and it just happened here a couple weeks ago, the parents, longtime parishioners of Ascension, and you would have certainly thought, well, they would have a Catholic Mass, but because of the world being like the world is, their families, their kids are just not practicing Catholics anymore. And so what they decided is that they would have a funeral liturgy outside of Mass. The rite of committal is something where we would also call that a graveside service. And so that can be after the funeral Mass, it could be after the funeral liturgy outside of Mass, but also it could just be a standalone. I get calls for that as well, that, you know, my mom or my dad passed away, we don't want to have a big fuss or anything else, but we do want a clergy member and we want prayer said, but it would be at the graveside. Also, funerals for children and infants, it varies a little bit, but it's very close to the ones for adult. The Ascension Funeral Book, I am going to touch on just a little bit because after I put this together, then I found out that as John had mentioned, there's going to be another follow-up where we're going to be covering that, but I will at least introduce you to that. Then what John had mentioned before, Joanne will actually be covering the Ascension Columbarium Garden. And then also, we had a new policy come out in 2016 regarding cremation. And so I wanted to touch upon that as well, because many of you who are my age and younger, then we remember a time where a Catholic could not be cremated. And so that has changed about 35 years ago or so. And so there was a new policy that was put out in 2016 regarding that, and that I want to cover that because there were some changes. Next slide, please. Okay, you can skip that one. It was just a little bit more. Okay, so vigil for the deceased, and I put there optional because, you know, some people just want their family members coming, co-workers, everything else. And, you know, we live in a very secular society right now. And sometimes it kind of makes people uncomfortable when you have a clergy member there. And so, you know, a lot of people either don't know that a vigil is an opportunity, or they just prefer that it be family and friends and co-workers and not have a religious component to it. I'm just putting it there so that you are aware of it. You know, you're entitled to it. If you want it, then it's there. If you don't want it, then it certainly is something that you don't have to have. I think parts of the country, it makes a difference. When I was growing up in Iowa, then there were almost always vigils that the priest came to and everything else. But here, you don't often have somebody coming to a vigil. Okay, and then this is the general outline where you will have a greeting. You may have songs, invitation to prayer, opening prayer, a non-gospel reading, a responsorial psalm, a gospel reading, intercessionary prayers, the Lord's Prayer, and concluding prayer with a blessing. Now, that's the whole thing. And the thing about it is you can pick and choose those things. You don't have to follow the whole thing. And that's one of the things that when you say, I want a vigil, then the priest or the deacon who's going to actually go there will ask you, what do you have in mind? Some people want to do poetry. Some people, you know, they have their favorite readings that they want to do and everything else. We want to work with you so that it's something that is meaningful to you as knowing the person who has died, so that it's not just a cookie cutter, that this is what's in the book and this is how we're going to do it. I mean, we want it to be meaningful to you. Okay, next slide, please. Okay, the funeral mass, and again, I put down optional because some people absolutely want a funeral mass, As I had mentioned in this particular paper, this lapsed Catholic wanted a funeral mass. For about 2 years or so, then I was kind of the deacon on call for Graham Funeral Home down in Chesapeake. And so I often got calls from the funeral home saying that they had a Catholic member who did not want funeral mass. They just wanted something at the funeral home. Well, you cannot have a funeral mass at a funeral home. You got to have a funeral mass in church. And so they were lapsed Catholics. They just wanted a clergy member there and everything else. So they opted for not having a funeral mass. But it is preferred. If you're a Catholic, it's the preferred method is to have a funeral mass. The church prefers a coffin with a body rather than cremains. And so if you're going to do what the church prefers, but you plan on it being cremated, then what they would prefer you to do is to rent a coffin, have that at the actual funeral, and then after the funeral is over, have the cremation at that particular time, and then have the committal after that for some times. Well, you know, it doesn't take a lot of people to say, well, that's a big expense. Also, the thing about cremation is it makes the actual period of time for the funeral to be very flexible. And that has been so true during the pandemic time where because of travel and everything else, then a lot of people just opted to put off the funeral until a later date, and then they would have the funeral, but it would be with the cremains. But the Catholic preference would be for that to be a coffin with a body at the funeral mass. And then there's a general outline. And since you're in a church setting and you have a funeral mass, then it takes on a certain more rigid structure than other things where you are not going to have Eucharist. And so you have the procession, you have the sprinkling of the remains with holy water, you have the opening prayer, you have the readings, you have the gospel and homily, you have the intercessionary prayers, you have the liturgy of the Eucharist, you have the possibility of a family reflection. That's up to the family. We often say 2 to 3 people, and not longer than 2 or 3 minutes, because I'm sure you've all been at a place where it's gone on and on and on, and you wondered, you know, when it was going to get over. And then the commendation prayers, and then the procession to the burial site or not. It depends. And then usually after the Mass is over is when we have military honors if they're appropriate. Next slide, please. Funeral mass outside of Mass. And so it's not an active Catholic, but on a Catholic service, or that they're sensitive to the Eucharist, as I had mentioned to you before. The church, again, prefers the coffin and body rather than the cremains. But the general outline, it's less formal, and oftentimes, as I mentioned, it can be done at a funeral home. But I've been surprised at how many, and we would call this more the liturgy of the word memorial service. But I've been surprised at how many liturgy of the word memorial service, which the deacon can lead. It doesn't require a priest because there's no Eucharist. But I've just been surprised at the number that we've had here this year, although we've had an awful lot of funerals this year. But a number of them have just elected to have Liturgy of the Word memorial service. But in general, the procession and greeting, the sprinkling of the remains, the opening prayer, Old Testament readings, gospel with a homily, intercessionary prayers, possible family reflection, Our Father, and commendation prayers, and then procession and possibly the military honors as well. But again, since we aren't in a Eucharistic setting in that sense, we have more flexibility. At one of them, the lady that died was from West Virginia, and one of the songs we had was Take Me Home, Country Road. And so, you know, there's flexibility again because it's not associated strictly with a mass. Rite of committal. This is a graveside service, and the timing is optional. It may occur immediately after the service. It may be at some point in the future. The general outline, and again, less formal and often done at a funeral home, is possibility of military honors, invitation to prayer, scriptural verse, prayer over the place of committal, prayer of committal of the body, intercessionary prayers, Lord prayer, concluding prayer, and prayer over the people. So again, the rite of committal is more of a graveside service, and it can be relatively short. Like I'm going to be doing an interment at 2 o'clock on Thursday afternoon. The people had already had the funeral service, and so that particular service will probably only take about 10 minutes. But if that's the only service that you're going to have, a graveside service, then what I would certainly recommend to people is that you have something more. You have readings there, and if possible, you have some type of music or something to elongate out that particular service. You don't want something that wham bam and it's over. And so if that's the only service that you're going to have, then I would certainly recommend people to have like some readings and things like that. Okay, next. Okay, this is Ascension Funeral Booklet, and I'm going to go through this relatively quickly. Don't worry about taking notes on this. Like I said, we're going to have a session just on this in a couple months. But the first one is just an information sheet that we use for internal things. And I was going to go through reading some of the questions and things like that so you knew, but you have the packets, and so I'll just let you go through that. So we aren't taking up time that we're going to take more time in the future. But this, and if you would do the next slide as well, this is really for internal consumption only so that we know what the readings are, so we know what the music is and everything else. Okay, next slide, please. Okay, this is page 1 of the actual packet. And the family member is given at least one of these, possibly 2, maybe even 3, depending upon how large the family is and everything else. And it contains a lot of good information. Next slide, please. Okay, first of all, it gives telephone numbers and names of people, and so that you know that, so you can get in touch with people. Because this needs to go both ways. We need to have some idea of what your thoughts are, what are some of your desires. You don't know family dynamics. You know, there's a lot of things that are happening that are below the surface. And so I just would hate to be somebody who would walk in to do a service and I had never met the people that I'm doing the service for. Because they have some expectations, and you want to know that this is a time that brings closure to a lot of people, and so you want to do it right. Okay, and this looks very familiar to that internal sheet only, except that this is what the family members are going to be doing. It includes them selecting the readings, the music, and everything else, and so this is important, but they have the booklet to kind of guide them through. Next slide. And then this is the back, and this is where it starts talking about gathering song and communion song and everything else. Okay, next slide. Okay, this is the music section, and I know everybody here knows that Diane is just a great person, you know, and a great musician. But these are options, you know, so that if somebody, when we say, what music do you want? Well, what's the first thing if you don't give them a guide? Well, what are my options? So what we're doing here is we're giving you some options, but this isn't the full range of what music is out there that they can provide. When I'm sitting with somebody and we're going through this, then oftentimes they'll ask me, well, can we do this song? And it's not on the list. And so what I'll tell them is I'll say, I need to get in touch with Diane and I'll get back to you. And I will tell you 9 times out of 10, she says, yep, we can do that. And so, I mean, we're really trying to work with you. We want the funeral service to be meaningful to you and your family. Okay, next slide. Again, same thing is true for the readings. Now, I have seen a place, and it wasn't here, but where they just said, we need 3 readings, one from the Old Testament, one from the New Testament, and 1 gospel reading. And they just gave the person a Bible or said, go look in the Bible and pick out readings. Well, you can imagine everything that's going on in their mind, all the decisions that they're having to make and everything else. And then if they aren't real comfortable with the Bible in the first place, and then you tell them to just pick something out, they're just overwhelmed. And so what we do here is we give you some suggested readings. And I always emphasize to people, you know, if there's something that was meaningful to the loved one, meaningful to the family or anything else, and if that's a reading you want, then we can work that reading in. We can make it work. And in fact, the first reading that, if you go to very many funerals here, a lot of people selected is from the 2nd book of Ecclesiastes. If you go to the funeral book that the priest uses and everything else, that reading isn't even in there. It's just that a number of people have shown interest in that particular one. It's the one that says, you know, there's a time for living, there's a time for dying, there's a time for planting, there's a time to uproot the plant and everything else. And when you look at somebody's lifetime, especially, you know, if they die in their 80s and 90s, you just know that over their lifetime, they would have experienced all that. And so a lot of people really love that particular reading, but that's not one that is even in the book. But so if you have a reading that you think, wow, you know, this was always very meaningful to Mom, or, you know, our family used to gather around the table and this is a reading that we use, we can make that work. Here at Ascension, I should add. I talked to somebody who came from a northern church, and they gave him the list, and they said, those are the only readings that you can have. But here, you know, the first reading is from the Old Testament, generally, except for Easter time. The second reading from the New Testament, and the third reading is from the Gospel, and you can flip through those. And so, you know, that's what we're looking for. We're looking for something that's meaningful if they aren't included in the ones that you have. On the back of that particular booklet is the prayers of the faithful. We call them universal prayers today, just so that we can confuse you. But, you know, and we give you about 13 selections here, and we say, you know, select 5 to 7 of them. You know, if you select 8 or if you select 4, we're going to use them. But, you know, and if you don't like these, then do something else, you know. But we'll work with you because, again, we want this to be personalized. We want this to be meaningful to you and your family. Okay, Joanne, you're up. Oh, I'm not finished. I'm not finished. I'll be back. I have one more slide.
Thank you, Gary. Appreciate it. I wanted to emphasize what Deacon Gary was saying, that, you know, we're here to work with the families and to make it as comfortable for you and your family as possible, because the whole idea of what we have to go through to help these families, it's a very stressful time. And we're very blessed here at Ascension to have a columbarium garden. And it's such a beautiful place to be. And the main thing on this information sheet, what I wrote up here, are the answers to the majority of the questions that I receive. So hopefully that'll, once you read that information, you will get most of your questions answered from that. How much it costs, who's eligible. We have it on the policy. It's for our registered members and their immediate family. So this was all created long before I became here. It's not my rule. And so we just want to emphasize these things to you. So that's there. It's also, this information is on our website under the menu tab of sacraments. You click on that, it does a drop-down bar to funerals, and you click on funerals. We've created one web page with some information just on general information on funerals and on, then you can click one more time and get this columbarium sheet information. So please, look through that, and if you have any questions other than that, please call in the parish office, and we'll be able to try to answer your questions for you. What we want to emphasize is that we want you to make sure you take your time when you're making this decision, that this being your final resting place, because it's exactly putting an urn into the wall is the same thing as a casket going into the ground. It's permanent, and this is a burial. I call it a burial because you're putting the urn into the wall. And so talk to your families. Make sure that before you call me to make a purchase for the niche, that you have talked to your families and you have no other ideas of, well, maybe I'll go and retire down to Florida 10 years from now. Don't come see me if you have those kind of ideas. You just want to make sure that, yeah, Virginia Beach, right here, this is where I want to be, my family's here, whatever the reasons are. So we just want to emphasize that. Please take your time. And we don't want to rush you when you do come into the parish office. It takes about 20 to 30 minutes. The main thing is we want you to be comfortable with making this decision. So get familiar with the columbarium garden. Look at the walls. Wall 2 is the one that's available now for purchase. And what's a little bit confusing, and this is one of the big questions that I have to answer all the time, is that when you first go into the garden, you'll see that the walls have names on them, obviously for those who have passed away, and then there's many blank stones. That does not mean they're all for purchase. Even on wall 2, that's the wall that's available for purchase. In the parish office, I have a chart that has all that information of who has purchased ahead of time, and of course who are already interred in the niches. So what you need to do is go out to figure it out, look at wall 2 currently, or whatever wall it's available, and then come in and make either kind of like an appointment in the afternoon. It's a little bit quieter, and we can go through things, and I'll give you more information on that. So any questions you have, you feel free to give me a call at the parish office. We'd be happy to help you through that process of purchasing. Of course, I always consider it a gift to your family. When you purchase ahead of time, before you have a funeral, before someone has passed away, it's so much better. It's such a loving experience. It's extremely stressful when a family has to come in once the family member has passed away, and then they have to purchase the columbarium. It can be difficult. The timing works out just fine when that does happen. There's the time of the cremation, the time for me to order the stone. It all comes in together, and it can be a beautiful experience. You just need to plan some. So thanks.
I want to add a little something. If you do purchase a niche in the columbarium, make sure your family knows, right, that you have it. I'm not kidding. Make sure they know that you have it. Also, make sure they know that when they go and see someone at a funeral home, you do not need to purchase an urn. We have had that happen, not very often, but do not purchase an urn. It comes with the columbarium. So it's just really important. You might even want to note that if you let your family know that you have a spot. And an urn.
Okay, thank you. Okay, my last slide is a question and answer on the Catholic 2016 policy regarding cremation. And this I am going to read to you. The question, and it was one of them in here. I understand that Catholics can't spread ashes over the ocean or land after cremation, and that ashes can only be buried or kept at home. That's the wrong answer. Okay, so the answer is, this question and many similar ones that I received reflects readers' continuing fascination with the disposition of bodily remains. You are correct in your understanding almost. The Church teaches that ashes from cremation should be buried in sacred ground or entombed in a columbarium, but not kept at home. In the Church's mind, cremated remains should be treated with the same reverence as the body of a deceased person. In 2016, the Vatican issued an instruction regarding burial practices for Catholics. That document specified that either the body or the ashes of the deceased should be buried in sacred ground, and the cremains should not be kept in private homes or scattered on land or at sea, nor preserved in mementos, pieces of jewelry, or other objects. Burial in sacred ground, said the Vatican, prevents the deceased from being forgotten and encourages family members and the wider Christian community to remember the deceased and to pray for them. The Church's Code of Canon Law continues to express a preference for burial over cremation because it more clearly expresses the Christian belief in an eventual resurrection when the person's body and soul will be reunited. So that's the official position of the Catholic Church on cremation and what you do with the cremains afterwards. And I know that being in the Navy for 28 years, that would really upset a lot of Navy people who were maybe perhaps looking at burial at sea. But that's the background behind it, that when the new policy came out, that I wanted to make you aware of. Thank you. Any questions? Should I ask that question? Okay, questions?
Any questions for any of our panelists? Diane is anxious to give the mic to somebody. Oh, Pat has one right there.
I just wanted to thank you for the funeral booklet. I had an occasion to use it recently, and it made things so easy because it was the second time I'd had to, be the person to make all the decisions, and the first time I had nothing like that to help me, and it was horrible. And it works. It works really, really well. And I just thought you guys should know that. Thank you.
Thank you. That's staff and Gary.
Diane?
Yeah. Yeah, we have a wonderful staff here. I'm sure you've noticed it. And some of them are here tonight. Any other questions?
Yes, John, I have a question. What about if you donate your body to science?
Oh, that's a good question.
Yeah, I'll take that. You can certainly donate your body to science. The Catholic Church, when they came out with their policy on donating organs and everything else, they approved that. And so the thing is, after they're finished, then they usually have cremains, and then that's when you can have your service. Now, one of the things that I didn't mention, but you certainly could have, is you can have a memorial service without a body or cremain. So if you've donated your body to science, a week after your death or whatever is convenient for the family, you can have a memorial mass, just like the funeral mass. Or if you don't want something that elaborate, we've had it where we've just had a daily mass, and then we specifically remembered that particular person at that mass. And so donating your body for science is certainly appropriate, and then we would have a committal service once the cremains came back.
Okay, thank you. Anyone else? Yes, sister.
Thank you for giving me the chance. Thank you for the presenters. I know what I might ask might be a little bit outside or close to that. All that has been presented to us, we appreciate, and some of us, we come from outside, far away, and recently also we had an experience. This is something educative to us. Thank you for bringing up this. My question is there something done with the family, especially those who have lost their dear ones, that they will be at least channeled with to be comforted and consoled after the burial?
Yeah, and unfortunately, that is something that we have identified here at Ascension, but it's not something that we have solved. And so you're absolutely right. For most families, once there's the lost one, people come in, family and others, and they support them a lot at that particular time, but then a week or two, they have all dispersed. And then where's the support for the family members who were very close to the deceased person? And for a while, up until the pandemic started, then we had a grief share here, which was a program like that. But since that time, the two people that were running grief share had said they are not going to continue to do that. So we're looking at trying to provide an option in that regard, but we have not solved that problem.
Anyone else? Yes. Over there.
Just wanted to piggyback on what Deacon Gary was saying about Grief Share. Grief Share is a national organization, and it's griefshare.org. This is what I've been telling people. I haven't had too many people call up for it, but since the pandemic, right before the pandemic is when the couple who were running that program here had decided to retire after 10 plus years. And then the pandemic started, so we couldn't gather anyway. But people are gathering online on the griefshare.org website. So that is a website you could go to, or if you know people, and to get some information and maybe some help. And I also have some booklets in the parish office you're welcome to come to take a look at to help out. So just, if you have questions, please don't hesitate to call us. We can help you get to some source. And in the meantime, Father Daniel has said to me that he will, after he gets back from his vacation, we're going to start looking at and addressing that, so we can hopefully get a group going again. So we just wanted to give you, there's a little bit of hope here. Thank you.
Okay, we have one more question coming up.
I'm interested in going back to dirt. Is there anywhere that's a Catholic can get buried where they can just not have they not all so much stuff around them?
Right. Right.
No vault.
No vault.
Green funeral. Huh.
Yeah, there are organizations. I hear green.org. My suggestion is the closest is cremation, but
If you're cremated, can you put your cremains in a grave, not in your urn?
You can contact any cemetery, and they can bury the urn in the ground, or just the ashes in the bag. Out the bag. I'm not sure if the Catholic Church goes for that.
Anybody
but,
have a shoebox that they can provide?
Shoebox? Okay. But yeah, you could talk to different cemeteries and see what they...
I don't.
You're thinking ashes to ashes, dust to dust, yes, but within the scope of, yes.
Joanne, can
Yes.
you research that for us? Okay.
I believe Berryville, the monastery, they do that. Yeah, it's just a biodegradable box. It goes back to the earth, and they put you right into the earth. Berryville, Virginia? Yeah.
Okay, good.
Monastery, yeah.
Berryville, Virginia, it's a monastery.
Thank you. Any others before we get ready to wrap up? I want to thank you all for... Sister, did you have a question? Okay.
Yes, you have to
Okay.
listen to Sister.
Oh,
She
I
works
know.
for
That's
God.
why I stopped in my tracks.
you have to listen to Sister.
Thank you. Maybe I may be asking something out. Maybe Gary, or you may help me understand, as Catholics and animals, do they have a Christian burial?
We do not do Christian burial for animals.
Unless the person was a real animal.
Yeah.
In that case, I guess we have to. Listen.
Why I've asked because I experienced whereby, animal, the pets we keep, they die. And the person insisted, prayer had to be said and the animal buried, and wanted to give the name of the animal so that prayer can be offered as we pray for the dead.
Wow.
So it was confusing. Thank you.
Yeah,
Thank you,
well,
sister.
it is a very touchy subject because people do see their pets almost, almost like human beings and things. But from a Catholic Church standpoint, there is a difference between a human and an animal. And so if you want to have some type of prayer service for an animal, then go ahead and do it. But Father or the deacon's not going to do it.
Yeah.
That was, can a pet be cremated and then placed in the urn with you?
Or buried in the same, maybe in a casket or something with you. Okay.
Oh, we had a suggestion to sneak
All
it
right.
in.
Before it deteriorates, listen, I want to thank you all for being here, but before we close up, that's a very important thing to understand, that we have a committee called the Stewardship Committee, and that committee is led very well by Miss Julie Brissett. Would you mind standing up, please, Julie? Julie. And we also have members, Becky Macchia. Where's Becky? She's still here. There's Becky in the back. We have Ken and Jonna Levins in the back there. They're standing guard. And also we have Lisa Lydell. She's on all the committees, so she's a member emeritus. But we've been working hard on trying to come up with topics, like I said in the beginning, that will be practical, that will help us understand life better. Money management, raising children, who knows? Please, you know who we are. Oh, by the way, I'm on the committee. Feel free to stop us and give us some suggestions, because we want to do things that will get a nice audience like this. And please tell your friends and neighbors that it will be available on will it be on our website? Is that right? I think Lisa's going to peek out and tell me. Yes, on the website. It'll be on the website within the next couple of days. So, also, most importantly, I want to thank Dr. Greg Warth for being here tonight, and Miss Jody Minnich, and Deacon Gary. We very much appreciate your time, and there are some blessings in heaven for you, I'm sure. Okay, folks, drive safely, and we'll see you again Saturday or Sunday.
It was a pleasure meeting you.